For the past 50 years, Texas has provided care to the uninsured through a combination of county-funded indigent care programs, yet Harris Health cannot keep up with demand, and more uncompensated care is provided in private institutions than in the public hospital system, Harris Health. And in suburban counties surrounding Houston, as the population of uninsured, low-income Texans grow, they have neither the funds nor the hospital district infrastructure to meet the growing demand. Over the years, the state has created a myriad of small, separate programs to deal with women's health, those with mental health conditions, HIV, and many other conditions. This multitude of separate but fragmented programs is wasteful and inefficient. At the same time, employers and others with health insurance pay a hidden tax in the higher rates medical providers must charge those with insurance to make up for the $18 billion in uncompensated costs providers absorb annually in Texas. This piecemeal system cannot continue as the number of uninsured skyrockets and the cost of care continues to rise. We can do better. The truth is we're already paying for medical costs for the uninsured, but we can and should improve access, improve outcomes, and save money by expanding coverage and modernizing existing programs for low-income Texans. We Texans are an independent bunch. We don't like to be told what to do or how to do it. So federal mandates in the Affordable Care Act are tough to swallow. Several of our leaders pushed back against the mandate that everyone must buy insurance, an expansion of the Medicaid program that already is consuming a bigger and bigger percentage of the state budget, federalization of insurance markets, and even more onerous requirements for employers. However, despite what you hear, most Texans conceptually support many aspects of the ACA, getting rid of pre-existing conditions and lifetime maximums, extending coverage on parents' policies to age 26, and closing the Medicare donut hole. We support making sure our Texas tax dollars come back to Texas. We know that we cannot continue the piecemeal, fragmented financing of our safety net healthcare system and need to move to comprehensive solutions. We believe in personal accountability, but also know that when we work as a community, we can usually accomplish much more than working on our own. We know that despite our dislike of most things Washington, there are billions of dollars available to Texas if we can find a way to work with rather than against the implementation of the Affordable Care Act. Now that almost all the ACA provisions have been implemented, we need to bite the bullet and figure out how best to implement the ACA in Texas for the benefit of Texans, while working at the same time with our congressional delegation in Washington on practical modifications to the ACA. We need to find a unique Texas solution to reducing the uninsured and improving the health of Texans using 4 key guiding principles. First, we have to increase personal accountability for health. We have to encourage healthy behaviors and good consumers. Secondly, we must reduce the uninsured by offering a plan to everyone in need. We cannot fix the big problem of healthcare costs with 6 million uninsured Texans, which leads me to step 3. We have to rein in rising costs by transforming the delivery of care and provider payment methodologies. Fourth, we must stabilize and consolidate funding sources. In order to draw down the $80 to $100 billion in federal funds potentially available to Texas over the next 10 years, any program must be approved by the federal regulators charged with overseeing the ACA. The good news is the feds seem to be very willing to allow innovation, and the ACA provides specific new flexibility for states in 2017 and beyond. Having spent much of the last 4 years listening to providers, politicians, bureaucrats, and the uninsured, we have developed a fairly detailed outline of what that unique alternative Texas solution could look like. Our plan, called Healthy Texas, is a 5-year blueprint to expand coverage, simplify and transition Medicaid CHIP and county indigent care programs, and replace the federally facilitated marketplace with one integrated Texas-specific program. It would be a marketplace for all legal residents under 400% of the poverty level based on consistent core benefits, but varying levels of cost sharing and premium supports. We see it as a more sophisticated, comprehensive approach, but in many ways similar to Arkansas, Pennsylvania, and other states that have resisted the Medicaid expansion and are now establishing their own coverage expansion under the ACA. We believe our approach will cover 1 million more Texans than the best projections for the ACA without any increase in tax on Texans. It sounds like a large and difficult undertaking, but since almost all Medicaid enrollees are already essentially in an exchange where they choose their own health plan, this approach is much more about streamlining eligibility and benefit processes than big new government programs. And it can be done with no new state funds. Existing state funds plus the new federal dollars are sufficient. In Texas, we like to think big. We have proven over and over again that if we just put our collective minds and wills into the task, we can do big things. We can turn Texas from the most uninsured and one of the most unhealthy states to the shining star of a healthy Texas.